Hi, my name is Ruth Amos. I'm an RNJD and I work at Cogent Law Group in Washington, D.C. Wow, well, it's been a journey. I started out as a nurse and got involved in a lot of clinical situations in critical care. And I saw the way healthcare was changing with DRGs and decided to go to law school and get into the regulatory space to have a little bit broader influence. And about 11 years ago, I got involved in digital health because I was one of the optimization and deployment leads for Kaiser Permanente that deployed 18 hospitals in Northern California. And I tease people saying after the 12th one, we got pretty good at it. So that was an amazing experience at the forefront of digital health with EHRs, specifically Epic. As I was going down the digital healthcare journey in the United States, I started exploring my family. Most of my family is actually from Estonia, which has been named the most advanced digital nation on earth. And so I've been very privileged to actually meet one-on-one with most of the people back there in that country who set up the whole digital society, including their electronic healthcare records, which went into play in 2003. And they've actually incorporated blockchain in their healthcare records since 2015. So I became very aware of the potential for blockchain and how to set up data so that it could really be more useful than what we currently have in our situation. Well, I see a few changes needed in the regulatory space. I'm not one for over-regulation, so I would love to have an opportunity to have industries come together to have a common ground. And I've joined a group, helping co-found a group, and I'm on the board of Blockchain and Healthcare Global, which emphasis on global because blockchain is borderless, and I want that to remain a priority. And so what I have been trying to get involved in is more, how can we learn ways as healthcare industry collaborators to self-regulate so that we aren't in a position of over-regulating to fill a gap in understanding or standardization. And so what I like about Blockchain Healthcare Global is that it's under the umbrella, it's a member of IEEE, which sets the standards for engineering on several levels, has a very good reputation, and just carries a lot of credibility when we're talking about trying to bring everybody into the same fold. We can go under that umbrella and say, let's get accreditation through that established organization. Well, actually, I've been working and talking with some people who have some ongoing live projects in other countries with blockchain. And I see it happening in, Walmart is taking up the sphere with food safety. There's some pretty big players in the market. I know IBM is, really getting into that, as well as the whole provider network project with Humana and the other folks at the table, United. And it's interesting to see these, once competitive people coming to agreement, starting to collaborate and talk to each other and find a common ground. So I get very excited about that. I also get excited about, the concept of blockchain not even being used in our vocabulary on a daily basis. I think it's important now as we start to understand the functionality and the use cases for it. But what I really get excited about is the public embracing what blockchain can do. Not so much what blockchain is, but what they get out of it for their work. And one of the companies I've been following very closely, and it could be a prototype for a lot of other activities in this regard, is a company called Limpo. It's out of Estonia. And I follow it very closely because it engages the public. It's going to launch in the States here in November 2018 in Dallas. And Mark Cuban, who owns the Dallas Mavericks, has signed a long-term contract with them and actually believes in it so much that he's renamed the Dallas Mavericks Training Center after the company, which is pretty huge. And so what that fitness app does is allows fans to go ahead and sign up for free, complete fitness and health challenges and get tokens automatically put into their account that can be traded for NBA merchandise, free Dallas Mavericks tickets to events. And it really, from a public engagement perspective, I think that's really a great entree into this market to show the public not what blockchain does, because I don't think people on average really care about what blockchain does, but what it enables them to do to stay healthy and to live a healthier, more active lifestyle. And so as they enter this market and people engage at that play gamification level on a sports level, then they can branch out and say, okay, why don't we take this to chronic care patients who have more challenges to get active, and say, how can we help them build in the right incentives to help them get active after we really see what happens in the sports market. So I get very excited about entries into the market like that, because I think on a public level it brings a lot of engagement to where people don't even talk about blockchain. They just get very excited about what they're getting from it and how they can stay healthy. And blockchain will just be this ubiquitous technology that runs in the background. So those are the things I get excited about. Time frame, it's hard to say whether 2019 is going to bring all that, but I think it's going to be very quick. I really do. I may have to give you my lawyer answer. I think it depends. I think it depends on people, how people want to use it. You know, right now I think we're being very cognizant of, let's not put too much data on there, so we don't want to slow it down. How many transactions per second can we encounter? I also know people who are reconfiguring blockchain platforms from some commercial products and saying we can run a lot faster, better, quicker. And so I think, there's a potential that could rapidly change, and we could get into a whole new dynamic of speed. But I do think, like any technology, it starts out at a momentum until you hit a threshold, and it's almost like a hockey stick. It just goes straight up from there. So I think as we get more use cases in and more data in terms of what the need for speed is, and the capabilities that certain platforms bring, I think we're going to see some innovations even on the platform itself. I think if you have any interest at all in a healthier lifestyle or more control over your data, I think getting involved in blockchain, or at least what blockchain can bring, there's several different ways you can get involved. I think if you are a healthcare professional, I would highly recommend getting involved in HIMSS, Health Information Management Systems Society. I've been on the HIMSS legal task force for about 4.5 years, and I made it a point to get the legal team connected with the HIMSS blockchain task force, because they need to start talking to each other early on. Once attorneys get educated in blockchain and what it does and really what it can do and why it's there, then they can educate the whole judiciary system, so that when you are involving blockchain type situations in court, you're going to have, from a legal perspective, you're going to have judges who now can be educated and say, oh, I'm not going to argue that into evidence. This is just going to be accepted. So there's a lot of work to be done in that space as well. Well, I do want to mention that blockchain is coming into the congressional fold very quickly, and I'm excited that it's bipartisan, okay? In our current environment, and I am filming this on Election Day, I think that it's very important that we focus on what we can do together, and blockchain seems to be one of those areas in which there seems to be a lot of agreement on both sides. So it's rare, but I'm grabbing onto it and running with it. And so there is a federal bill out right now that was introduced in October of 2018 that is HR 6913 that we're all following very closely, because it's kind of setting up the ground, the table stakes, if you will, putting the stakes in the ground to formulate some kind of blockchain roadmap. And so I know California and Arizona have already passed blockchain definition laws, and the good news about that is they're the same. And so I'm encouraging other states to build on that and keep this continuity going and keep the cohesiveness and the collaboration in progress, because that's going to really make what we need happen. and have a fluid access to our data.